Thank you, Mr. Chairman. I think it's been an excellent hearing. I want to commend you, and I think your point, Mr. Chairman, about Senator Nelson's absolutely right. And he has been in the vanguard of senior rights for a lot of years. And I really want to pick up on Senator Nelson's point and perhaps direct this towards you, Mr. Levinson, and you as well, Mr. Ferrer. I mean, what Senator Nelson is really talking about with respect to seniors on patrol really elaborates on the concept you've been talking about, Mr. Levinson, which is really to have more people looking at the data. You know, I've listened to you talk about this for a number of years, and you've talked about data analytics and data forensics, and it really is another way for addressing what Senator Nelson was talking about, which is having seniors on patrol and sort of getting more eyes at this whole topic. Now, Senator Grassley and I have proposed an effort to open up the Medicare database to make it possible for us in a fashion that allows for more eyes to be on the subject, for us to stop these sort of abnormal trends, the kind of people who are ripping off the system, acknowledging what Dr. Bedetti said, that most people are honest. Given the fact that I may even be one of the last senators to ask questions, isn't this really what the panel is trying to get us to zero in on, is to have more eyes on the data, more people trying to give us an early warning sign of developments? As you know, we've had some of the most outlandish, cases on the West Coast, one of them in Portland. So we have tried to follow this, and I would just ask you, Mr. Levinson and Mr. Ferrer, about this question of trying to really put more people looking at the data, whether it's the approach Senator Grassley and I are talking about in terms of opening up the Medicare database or other approaches. That's really the bottom line here. Is that your view, Mr. Levinson?
Thank you, Senator Wyden. Well, I've been on record for a long time as encouraging as much transparency as policymakers and the lawyers will allow us. I think it's very, very healthy for the system. And the notion of citizen involvement, and especially Medicare beneficiary involvement, is absolutely crucial in trying to ensure the integrity of the system. And in every summit that HHS has held on the fraud prevention challenge around the country, and there have been half a dozen over the last year, in my remarks, I always underscore the importance of having our beneficiaries as our frontline protectors, if you will. And when you look at the record of our OIG cases open for investigation, I have to assume that a considerable number of the hotline complaints that come in and that are then forwarded to CMS, their sources, their origin most likely is from exactly this cohort, the people who are on the front line. So while government obviously has, all parts of our government enforcement and compliance structure have very critical roles to play, a crucial partner needs to be the beneficiaries themselves.
Mr. Ferrer, tell me about your thoughts with respect to approaches like the Medicare database, because that's the one place where you can really, on an ongoing basis, spot abnormalities, spot trends. Do you have any thoughts on that?
Well, I couldn't agree with you more with respect to the importance of reviewing that data. And let me tell you why we have been so successful in the strike forces and in our efforts. In Miami, we actually have what we call the Fusion Center for Medicare Fraud. It's a standalone facility, the only of its kind in the nation. Why has that worked? Because we have a CMS contractor working in that facility with agents, with a nurse investigator, and agents whose job really is to look at the data. So we have a national database, and it's called STARS. They review the STARS database to see where there's some aberrations, some suspicious billing spikes, and then they come to us and to the agents and then point us to the right direction so we can know which providers we need to sort of examine and investigate. The beneficiaries getting involved in also in this effort is crucial. We have cases where it's the beneficiary, it's the patient who comes to us after examining their explanation of benefits from Medicare and say, hey, listen, I'm being, Medicare just got billed for a prosthetic, and, you know, look here, I don't need anything. One of the beneficiaries was a federal judge who Medicare, you know, someone got his information and was billing Medicare for some prosthetics, and he had to go to court and tell the judge, here I am, and I've got my limbs. I mean, we need everybody. We go out there, do a lot of public outreach. The regional summits that Inspector General Levinson is talking about is crucial. We tell everybody that they need to speak up and be aware. And I've got to tell you that, at least I can speak for South Florida, the community there is fed up. That's why, you know, we put a lot of research into this. That's why our sentences have increased. Senator Coburn was asking about doctors being sentenced. We've had doctors sentenced to 19 and a half years and 30 years. The judges are trying to send a message in this area. But reviewing the data and anything we can do to continue to facilitate the sharing of quality data in a timely fashion is crucial in our efforts.
Mr. Chairman, my time is up. I just look forward to working with you, and Senator Grassley and I have put a lot of years into this, and the fact that you're constantly looking for ways to beef up the fight against fraud and these kinds of ripoffs is really appreciated. I look forward to working with you.